All right, I think it's recording now. So I'm sorry, guys, we missed a little bit on not recording most of the stuff, but just a kind of quick recap because I don't want to deviate from the subject is that one, before the interview, the most important thing is that you know the program, you know the specific things that the program is trying to sell so that you can show interest. You want to know who are the people interviewing you عشان تعرف to kind of break the ice as we're going to talk in the second part of this discussion. Prepare the basic questions that everybody asks, كل interviewers asks. For example, tell me about yourself, what made you choose medicine, why do you want to come here? These standard questions are going to be asked from everybody. So especially هلا زي ما حكيت أنا virtual interviews, you can literally write certain points that you want to show in your CV and certain questions وحطهم على جنبك جنب اللابتوب and you can look at it without nobody's noticing. So that's something really important to kind of do. And I would ask you very importantly to know what are you interviewing for, whether it's academic or it's community, because it's different in the way that you need to sell yourself for that program. Our end goal is that for any applicant to be ranked so high, and eventually you get to choose. Whether you like the program, you don't, that's totally up to you. But you want to let every program rank you high, and that's the skill in getting the interview. Because as we start this talk is that once you get the interview, you're in a very small pool of applicants that gonna get ranked. Unless you do something bad in the interview, you're gonna be ranked. Now, based on شطارتك, it will depend on you're gonna be ranked high or you're gonna be ranked low. So let's shift gears here now and go into the virtual interview. So in virtual interviews now, and I've done a handful of these interviews, is basically they're gonna send you the link, obviously, you log in, they're gonna do a program overview. They're gonna tell you what things that their program does, what's the strengths, what they're trying to achieve from training, how many residents they take, etc. Just the basic information. So this is kind of like the first part of the interview. The second part is getting into a break rooms where they send you as you're the user with a certain faculty, and you go into a special meeting, like a small meeting between these two. And there's a timer up top here that's around like 20 minutes. I don't know if it's going to be 20 minutes, 15, sometimes 30 minutes. It depends on the program. They're going to tell you that. And during the interview, once it's done, you go back. You don't do anything, actually. They just pull you back into the big meeting, and the applicants are the same. There are also going to be breaks where they kind of like put you in a break and your camera turns off. You can go have like a sip of water or something like that. وبعدين finish these kind of like marathon of interviews. وبعدين go into the interview. بعدين finishing up, wrapping up the schedule and getting done. So the things that you need to do in this session, you don't want to sound awkward. The best thing in the pool where all the applicants are is that you're just actually sitting and like a small smile and just like waiting for your turn. We've seen a lot of people who are trying to be funny. They're trying to kind of interject into the conversation by showing something, I don't know, like that. I would strongly recommend against it. I would just like kind of stay like, just like you're attending this meeting. Your camera's on, you're sitting in front of a laptop, and don't do anything unless you're asked for. So because you're gonna see sometimes the faculty talk to each other during the meeting, you're not gonna know what they're talking about because it's your first time meeting them. So the best thing you need to do during that time is just to stay quiet and just a small smile. Once they send you to the interviewer, this is your opportunity to impress. Because one faculty can vouch for you and say, I like this guy so much, you're going to be ranked in the top, I don't know, 10 or 5, and you're going to end up matching here. So this is kind of your opportunity to show what you want to show. And this is kind of the art. He will start asking the questions, of course, and most of the questions start telling me about yourself, just like a regular interview. And you kind of like have this prepared in your mind. You start going with some sort of a story that you prepared or whatever it is. وبعدين you want to point them toward what do you want to say. For example, إذا أنت مثلا, especially at this time, عالجت كتير COVID patients, I would kind of like direct that conversation into that place. You know, things in Jordan were really well. They did a really good shutdown. Everybody was talking about it in the news. But then once they start opening up back again, the cases increased massively. The hospital are full. My hospital is this and this, and I treated this and this. So it's kind of, I'm just giving an example here on what are the important things that you wanna need to do in this interview. Most important thing in your part is that to try to avoid silence in this. So you're gonna make it the least awkward possible. So if there is like kind of an awkward silence, I would take the initiative and ask a question at that time. If the faculty is talking, I wouldn't interrupt him because even with this like virtual situations, that you're gonna be prepared to stop at any moment because you don't want to be talking and the faculty talking. That's gonna make it weird. So this is a very important thing to do. Things you shouldn't do in the interview is basically making sure that you're not upsetting somebody. And this is very, very hard because this the guy or that person, this is the first time that you're meeting him. You don't know what he's into. You don't know what, he doesn't know what you're into. So you want to be careful. By careful, the only thing that you need to be is be polite and be yourself. So you're asked a question, I would answer it. I would refrain from making jokes because, as I said, this is your first time meeting. So there's no need to try to be that person in the room that's trying to make jokes or something like that. You don't need to be funny, to be honest. So I would stay professional and polite. These are the most important things. And lastly, again, and here we're coming to that point, is that you're trying to sell yourself. And you want to show that, hey, I've done this. I worked so hard. In Jordan, مثلا, أغلب الأماكن is a community practice or private setting. So if you're interviewing at a private hospital, you want to show that part of your career where you did a lot of rotations in the hospital, you saw a lot of patients, you're ready to work hard, and you're ready to take responsibility. If you're interviewing for academic place, you want to show that you, in med school, you did some sort of a research, you were involved in teaching medical students that are younger than you, these kind of things that's going to make the faculty impressive. Now, let me tell you from my personal experience. I know I'm talking a little bit a lot here, but excuse me. So from personal experiences that I interviewed here in my previous program, Marshall. And Marshall is kind of semi-private practice. You know, it's not like the pure academic place. And Northwestern is completely academic hospital, top ranked, very prestigious and everything. So during the virtual interviews on at Northwestern, because that's what we're going to be focusing on, I have interviewed people coming from Harvard, from Johns Hopkins, from Mayo Clinic. They are top-notch people on paper. If you open their application, and I was really surprised because I thought that we as IMGs, they have the high scores, or we have the high scores like 260s to 70s. I've seen applicants that are scoring 270s and their USMLEs and their American grads. So I just want to put it here in the room and like in this meeting, because I want you to know, you passed that test, you got that interview, you might be interviewing with a very strong internal candidate coming from the US, from a very good hospital. The way that you need to do it is that you need to be yourself. And the way that you're going to nail this interview is by the following. One is that being humble, regardless of your scores, regardless of your education, regardless of your experience and research, you want to be yourself. And you want to say, I'm really humbled to get this interview. I'm very excited to be here. This program is excellent and I would love to train here. You want to throw these sentences that you want to show them that you're interested in this program. If you strike them as an arrogant applicant, I guarantee you, even if you get the interview, you're not going to be ranked. And I've seen this. Post-interview sessions that the faculty discuss the applicants, a lot of people got this notion that, hey, this applicant is arrogant, we should not rank him, and he's not going to be ranked. So that's very important. And I feel at some time that it's a fine line between applicants trying to sell themselves that they're really good and they're being arrogant. So you have kind of to be able to being humble, showing interest, and selling yourself. it's really an art, and it's not easy. I'm not saying it's easy. So let's open the discussion. محمد, if you want to تعقب على كلامي.
تمام. دكتور، هسه بالنسبه للفيرتشوال انترفيوز صراحه انا يعني انا السنه الماضيه لما قدمت قبلت واحده يعني فيرتشوال من الاجوني، وفعلا يعني كان الموضوع حسيته شوي اصعب من يعني ما بتقدر تعطي امبريشن بسهوله زي لما تكون صراحه مع واحد يعني على ارض الواقع. ف يعني انه يعني الله يعطيك العافيه على اللي على اللي قدمته للجميع يعني، وان شاء الله الكل يستفيد منه. انا صراحه بس في عندي شغله بالنسبه انه جوا المقابله بالكلام، يعني لما حكيت انه لازم الواحد يكون بولايت وكذا وزي هيك، في نصيحه عمليه حسيتها فادتني يعني بالمقابلات، انه انت دائما تكون على مستوى اقل من اللي بيحكي. يعني اذا هو مزح معك ما تروح انت تعمل مزحه مثلا، يعني خلينا نحكي بزياده، انه امزح معه بس خليك تحته يعني بمستوى الكلام ومستوى اللي هو انك يعني بريكنج ذا ايس، يعني خليه هو اللي دائما يسوي هذا الاشي مش انت اللي تعمله. كثير اتوقع انهم كثير بيحبوا الاشي هذا، لما يشوفوك انك تتفاعل معهم على هذا النمط، اتوقع بيحترموا الاشي هذا هم يعني، وبرضه بيفهموا انك انت زلمه يعني بتاخذ وبتعطي بالكلام، مش انك يعني تكون مؤدب زياده عن اللزوم بحيث انك تبين زلمه جامد. يعني برضه هم بدهم يعني، هو طبيعه الطب والاقامه يعني جو صعب كثير، فانه اذا يعني الواحد لازم ياخذ واحد شخصيته كويسه انه ياخذ ويعطي معهم. فانت برضه يعني صح بدك تكون مؤدب، بس بنفس الوقت بدك تعطيهم الفايب هذا انك انت زلمه، لا يعني ممكن شخصيتك حلوه برضه، ويعني راح يستمتعوا بالشغل معك. يعني هي الصراحه الشيء الوحيد اللي بدي اضيفه يعني.
بالضبط. يعني
راح اضيف غير هيك
يعني especially if you're يعني, and this is very important, if you're interviewing مثلا the chair of the department, that somebody that's like has his own like entity, and it's different from program director, is different than somebody. He might joke about, for example, it's really weird interviewing you applicants on Zoom. I wouldn't say like trying to come up with something worse. I would say, yeah, it's been really difficult, but we're trying to manage. I would kind of like carry the conversation in a polite and respectable way, because you never know when you're going to cross that line. It's something really imaginary. You don't see it. And he's not going to tell you, oh, hey, you're rude or something. No, he's just going to maybe write something on a paper. And after the interview, they're going to mention that. So we've got a couple questions here. How I sound interesting when talking about yourself. You are what you are. So everybody is different. And I'm telling you that because everybody has different story. Like you can't really answer this question unless you have a clear insight of what you are as a person. يعني مثلا everybody has some memorable interaction with medicine, and you would say that to kind of make yourself, you thought about the situation and that made you to be that person, because they want to see that you're a person with a purpose, and that what makes you interesting, right? Like, for example, you want to do internal medicine because your dad had diabetes. It was so hard to manage, and I wanted to be really good at it because I felt my dad suffering. Something that makes you kind of like interesting. This is why you are what you are as a person in this interview. So it's really difficult to answer this question, but I would say be prepared for it. I have a hard time answering this question last year. Why should we select you? Okay, so again, let me tell you this story about one applicant. And the reason that I mentioned San Barnabas, one of the community programs in New York, it's a small program, doesn't have any affiliation with any university program. And there's this resident coming from that program, applying here, knew somebody, recommended him here, and he managed to get the interview. So his name was literally the only person that didn't have a university program next to it. And everybody else was MD, PhD, and very, very super competitive applicants. However, this guy was able to impress the people more than anybody else, because post-interview discussion, they said that we should get this guy. But let me tell you how he did it. So when he came into the interview, he recognized that he's like not the strongest applicant in the list. And a lot of other people are applying. A lot of people have the interview skills, and he doesn't have it. So he came in with this mentality that I finished from this community program. It's a small program. It's in the middle of New York. We've treated a lot of COVID cases. I'm very humbled that I got this interview. If I get this opportunity, I will be very hardworking. I will be very productive at research. I want to do this and this and this and this. So this impressed him that he's really wants to come here. And it's not a mistake to say that you want to come here, because if you are really want to come here, just say that. They're not going to be offended. It's not wrong to say it. So he mentioned that, and he said it in a nice way. And on top of that is that after each interview, he was asking the faculty, because most of our faculty are really very famous people, and he was asking them, what can I do or what advice you have for young people like us? So he was asking the chair of the department. And after the interview, the chair of the department said that this guy has really impressed me, that he was able to come from a small program, yet that he's going to be ranked very high, despite having people coming from Harvard or Johns Hopkins or these kind of places. So this is the way to do it, is that you have to be humble, you have to show interest, and you have, most importantly, to be able to impress these people in a nice way by trying to make them that they're very important to you. They've done a really amazing job in this, and that's why they want to do it.
صار معي موقف مشابه أنا كمان، وهو بالبروجرام اللي متشت فيه يعني عشان هيك إنه برضه النصيحة إنه الواحد جد يحاول يكون يعني نفسه قد ما بيقدر. يعني أنا البروجرام تاعي بالعادة الآي إم جيز اللي بقابلهم بكون مثلا عامل لهم سنتين ريسيرش، مثلا بييل بكورنيل وكذا، فوقت المقابلة نفس الشيء. يعني كل الآي إم جيز اللي كانوا موجودين اللي عامل سنتين ريسيرش بكورنيل واللي عامل بييل وكذا، فأنا أحس إني طالب توجيه ومخلص توجيه وجاي يعني جاي أقابل حرفيا يعني. فسألت السؤال هذا، حكت لي what make you different from different، يعني شو اللي بخليك غير عن الابلكنس؟ قلت لها nothing يعني. وبعدين شرحت لها بس انه انا يعني اذا بدك انت تطلع على الورق nothing، يعني اكون صريح معك يعني. بس الفكره انه انا اللي بيميزني عن اي واحد ثاني انه انا لما احط يعني راسي بشغله اسويها بسويها، ومن ضمنها اني انا انكم بعثتوا لي مقابل رغم الديسبرنس بيني وبين الابلكنس الثانيين. ويعني كملت جوابي، فهي سكتت وحكت لي صراحه هذا احسن جواب سمعته بحياتي يعني. فيعني الواحد ما يكونش overwhelmed، يحاول يكون يعني احيانا الجواب ممكن يطلع معك لحاله سبونتينيوس. انا الجواب صدقا ما عمري حضرت له يعني، لانه بدك تحضر له بضلك تجاوب بصير جواب مستهلك. فبرضه هاي النصيحه برضه، لا تستهلك اجوبتك، يعني اجوبتك راح تتطور مع المقابلات اللي بتقابلها برضه. يعني ممكن انت تكون حاطط التمبليت تاعك اول جواب تجاوبه باول مقابله، بس راح يتغير مع الوقت انك انت راح تصير تعرف حالك اكثر بالمقابله لما تصير تجاوب هاي الاسئله، وراح تصير اجوبتك تتحسن كمان مع الوقت يعني. فالجواب نقطه وقت او باخر راح تعرف انت تجاوبه بطريقه كويسه، يعني اذا جد بتشتغل لحالك وتفكر مضبوط يعني.
Yeah, and one thing that we didn't cover in this is that try to schedule the most important interviews for you at the end, and the small or the things that it's not your top list at the first, because it's natural that you're going to make some sort of a mistake. يعني هذا شيء طبيعي، احنا بشر وكل راح يغلط. You still going to be, I mean, I'm not saying that they're not going to rank you or anything like that, بس أهم شيء إنه أنت بالأول is to try to practice on how to make yourself natural, very interesting person, regardless. Because again, once you should forget your scores, you should forget your medical school GPA وعلامتك ما بعرف ايش، كل هاي الشغلات لازم تنساها، لانه انت once you get the interview, then the only thing that's gonna matter in ranking I mean بنحكي كمان شوي على full post interview discussion, but the most important thing that's gonna make you rank high versus average is you as a person. Some people have the most average application, but they get ranked high because they show what the program needs to know. I'm a hardworking, I'm a natural person, I'm not a malignant person, and I don't have like any of these shenanigans that a lot of people show that they might have, and that's why the programs get scared. So this is a very important point that you brought up, Muhammad. And one of the questions that with the COVID situation is, I don't know about the timeline, to be honest. I would definitely, so what I think what's going to happen this year about the interviews is that there's going to be applicants, there's going to be, let me put this in a good way. So the American, they're going to apply everywhere. As an American grad, the most important thing that matters for them is المصاري, because they have a lot of student debt. So لما كانوا يقدموا على الماتش قبل سنين، لما كان الوضع طبيعي، كانوا بيحسبوا حساب إنه في سفر وفي هوتيل وفي دفع مصاري. And they consider themselves that they're going to be able to match. So that's why they limit their application. بس هلا مع الوضع, what we've been seeing is that everybody is applying everywhere because it's just a Zoom call. يعني هلا just بعد ما هذا التليفون يخلص, nothing comes out of it. Worst case scenario is that you're not going to be ranked in that program. And it's only $10 or something like that. So I would expect that the number of interviews for IMGs is going to shrink. That's a given. I would really think that the programs, they're not going to be giving priorities to IMGs as AMGs, because they're going to be surprised, oh, hey, I got an American grad, and I would definitely would rather take an American grad. This is not true for the strong programs. The strong programs will do a merit-based system. They will rank the applicants based on their scores, then they will start sending interviews. بس للبروجرامات الثانية medium size program is that they're gonna يحسبوا حساب إنه they can't send that like 3,000 interviews. They're not gonna be having the manpower to do it. So that's why the number of interviews might be less, but each interview counts for you. So that's very important to focus on. And they might come in late, because a lot of people, what's been going on, at least in my program, is that they've been discussing the applicants after the interview so that they know where is it going to be on the rank list. So sometimes they're going to feel that this guy is awkward or something like that, so he will not be ranked. They might have some space so that they might send interviews down the road, maybe in December or January or something like that. I'm not really clear, but our schedule, at least the schedules that we got for the residency match, is that they're going to start interviewing in mid-November and moving on. Let's see, at which part of the interview do you usually show them that you know the program really well? So the most important one that needs to know that you know the program really well is the program director. لأنه الfaculty, they're not going to be really interested that you know the program really well. The most important one is the program director interview. If you show that the program director interview that you know this program really well, that you are interested in this and that and this, for example, yeah, asking about education, asking about the clinic, asking about various types of the program that you think it's a good question, then he or she will like you. They will remember that, hey, this guy asked me about this, he must be interested in my program. Let's see, is it okay to reschedule?
Can I ask a question, please?
Yeah.
Yeah, you said before the emphasizing about to be simple and humble, and it's not easy to have a balance between being confident at the same time to be simple. So يعني في كتير ناس حكوا لي على هذا الموضوع. إذا أنا بدي مثلا أحكي مثلا إنه I have a previous residency training وأنا بدي أخليها in simple way، يعني ما بدي الناس اللي قبالي يشوفوا إنه الشغلة إنه هاي عندها خلص residency وعاملة مثلا سنتين مثلا clinical training، إنه شو جاي تعمل مثلا عنا. فأنا هاي الشغلة إذا بتقدر مثلا ممكن تعطينا tips، يمكن في كتير ناس
really good question. Because the way that you might want to bring it up is during tell me about yourself. Like أنت بتحكي مثلا أنا خلصت من الجامعة الفلانية، بعد هيك بلشت أشتغل هنا. I did part of my training and I've done this and that and this. There's completely no bragging about it. I would say bragging would be is that if they tell you how you handle a difficult situation, you would say, well, I have my experience, I've done this before. They're gonna find that, hey, this guy is overconfident or this. person is overconfident, and I don't think he's coming to learn. I think he's coming just for the match. So like the way to sell it is that saying that during your presenting yourself, because presenting yourself is not bragging. You asked me who am I as a person, and this is my answer. There's no bragging about it. So this is what I would bring it up. I would definitely try to focus on it once you feel that the program is looking for people, like if their program is busy. So a lot of programs here in the US are very busy in practice. So they want to feel that, and a lot of the time they select applicants with the prior residency training. Yeah, if you look at Cleveland Clinic, most of the applicants that they interview, if they don't have that high score, they will look at applicants who did residency in Qatar. They like that. They know that people عملوا residency in Hamad, they're exposed, they're going to bring that up. So people bring that up there. If you feel that most of the applicants are fresh graduates and they expect from you to learn, I would not brag as much as about it. But if you feel that the program is saying, we have a very busy program, and how would you handle stress? Then you would tell them, I've been under a lot of stress during residency in Jordan. We don't have the CAP system. We admit a lot of people. We take with a lot of patients, and I've kind of developed a system for myself to make sure that every patient is taken care of. This is not bragging. This is just like stating that you are a good applicant and you want to be there. Does that answer your question, Asma?
Yes, thank you. So it's according to the program, like personalization. أنا بعرف مع مين بحكي. ونفس الوقت إنه يعني to show interest, to show إنه أنا جاي أتعلم، أنا جاي أعرف. whenever يعني الواحد قد ما صار يعني بالآخر يعني every day we'll learn something new يعني. هي هيك يعني بتوقع.
I totally agree, because it's a fine line between bragging and selling yourself in a good way. It's something that you just have to master, and that's why it's important to schedule interviews in INTA you're really interested in at the end, and interviews that you're not really have as a top choice at the start, so that you will know that this guy really liked me. I said this thing, and he's like a neutral person. He's not liking you because he knows you from before. No, he liked you because your answer was good. So any other person that's neutral is going to like that answer. So that's how I would pace it. I think we're getting a lot of questions, so we'll try to keep up. We're coming into the letter of interest to the program. If you're meaning about before the interviews, it doesn't harm. If you want to send programs emails, some of them, they're not going to open it, so you're not losing anything. And some of them will open it and might like something that you wrote and send you an interview. So there's no harm in sending this. And I've seen this in residency and fellowship, so that doesn't really matter. I think I said, go ahead.
تسمح لي بسؤال الله يعطيك العافية.
Go ahead.
If I'm planning on taking step 3 and I've scheduled for it, is it okay to bring it up in an interview?
Yeah.
And if so, how do I bring it up in the middle of an interview?
So I would say, so it's going to depend. If your program allows during residency fee, they're going to ask if people have done step 3 so that they can schedule them. So the program director might ask you, for example, what have you done so far? How is the interview season is going? She's going to ask you this, trying to break the ice. You would tell her, or bring it like kind of smartly, that I was preparing for step 3 and I'm going to give it at this date or something like that, so that they will know that you're giving step 3 in an indirect way. That's going to make you more competitive for sure, but that's the way that I would bring it. Something subtle, يعني مش إنه أول ما تحكي عن حالك أنا راح أقدم step 3.
Great, thank you very much.
I think I skipped a question. Is it okay to reschedule interviews even at Thalamus or whatever website? There is no harm. Everybody's doing it, whether you're an IMG or an AMG, it doesn't really matter. So if you want to reschedule your interview 10 times, they're not going to be offended, because the program director and all these people, they're not aware of this. This is just between you and the coordinator. So keep emailing her 10 times. Don't feel تستحي أو شيء زي هيك. It doesn't matter. She doesn't have a say in this. So I wouldn't be really, whatever works for you is whatever works for you. Next, being a resident in a different field that I'm currently training, applying to the match, is enough to say that I lost interest. So I don't like saying lost interest. I would say that it's not my ultimate career goal. You don't want to sound like a quitter or somebody that quitting in the middle of something. They don't like that. So I would definitely try to bring it in a way that this was the opportunity available for me, and I wanted to take it because I don't want to be not doing anything after finishing med school. And things are tough in Jordan. Again, bringing the difficulties that you did during medical school and after med school, it's not a weakness for you. It's something that's going to make it memorable for you. إنه هيك صار. So أنت you were able to overcome this. يعني for example أنت بدك surgery residency وبدك تقدمها بالUS بس بالأردن ما كان في space. So you did internal medicine. There's nothing wrong with that. يعني and I know a lot of famous people behind an institution that they wanted to do one thing and they were not able to get in it, and eventually they did this thing and they were successful in it. So I wouldn't say loss of interest. I would say that this was the opportunity that was available, and I'm really hardworking and I want to take any opportunity that I get. Based on your experience with HEMONC fellowships, interviews, anticipate change in the number of applicants are going. So my experience been with residency and fellowship, unless the applicant do something bad in the interview, he's not going to be ranked. Otherwise, everybody will rank. Because at the same time, the program doesn't want to end up going to SOAP for the scrambling with applicants that didn't interview. So at least that they know that you're not a bad person, you're going to be interviewed. Based على شطارتك, you're going to be interviewed ranked high or med or low. I don't think there is a harm in doing so if one help somebody probably. Oh, you were answering this, Muhammad, sorry.
يعطيك العافية دكتور يزن.
Go ahead, Sam.
ممكن أسألك سؤالين. هلا في حكيت أكثر من نقطة. هلا إذا واحد فريش جراد، أنت حكيت إنه بدك تذكر الأشياء اللي مريت فيها بالأردن كتريتنج بيشنت. أنت يعني كواحد فريش ما عنده أي إكسبيرينس قبل هيك، لا بريسيرش ولا بأي شغل مثلا غير مثلا الامتياز. هذا السؤال الأول. والسؤال الثاني، أنت حكيت على التيتشنج. هلا التيتشنج باليونيفرسيتي وبالأفلييتد هوسبيتال هو ميزة. إذا أنت عندك مثلا إكسبيرينس بالتيتشنج، بس أنت حكيت إنه هذه النقطة بدي أكد عليها، إنه الكوميونتي غير الأفلييتد هوسبيتال ولا إنه نفس الشيء؟
So it depends. Some community practices have affiliation, some don't. Teaching is never wrong in any program, whether it's community or academic. So you want to say that I really love teaching, so you can always teach residents, right? You can either do lectures for the residents, part of the curriculum. One thing that's this good thing that you brought it up is that I really found the program directors like the people who say that they want to be part of the teaching committee. Like I would ask, do you guys have like a resident teaching committee? Because a lot of programs have it. And you would say, I really want to be part of it. I want to give residents lectures and also try to improve the curriculum as we go on or something like that. They definitely would love that. But teaching as a part of community versus academic or affiliated or non-affiliated, it doesn't really matter because you're going to be teaching a resident or intern as you progress in your career. Can you please...
بالنسبة للسؤال الأول اللي هو بالنسبة للفريش جرادز، أنت حكيت إنه كيف ممكن إنه...
So use الامتياز. I know you probably, I don't know, I mean أنا myself this long time ago, بس أنا الامتياز ما كنتش موجود أصلاً بالأردن فيه. So use the امتياز from the stories that your friends told you. You know, I was like drawing blood and I was given this X number of patients and I've seen this and that. This would be an experience. And again, you could bring that part of you if you're a fresh graduate, that you worked very hard to finish your USMLE exams, to try to come to the US and do your training here without having prior training in Jordan. Again, it's not a weakness. It's if you have it, it's good. If you don't, that doesn't mean anything. It's not like they're ranking the applicants based on their previous residency training as the only factor in this process. So I would use Central Imtiaz. If you don't feel comfortable using Central Imtiaz, I would just like kind of say, I really worked hard, focused on doing the exams and coming here to the US. And the only thing that I want to do is get training from the US residency programs. That's the way I would do it.
شكرا كثير دكتور.
الله يعافيك. what's the most important to show as I think somebody was asking what's your weaknesses. So I think there was a post على الجاب, and this question is really, you're not going to be finding it at every interview. That's what I can tell you. Only people who are asking it are the ones who are running out of questions, to be honest. Yeah. The weaknesses, I wouldn't be naive in putting a weakness and بطنة be strength. Like, you know, I'm a hard worker and then something like that. You're going to sound silly, to be honest. You're going to find a weakness in you, not related to work. You don't want to sound weak or anything like that, that you're trying to improve on, or something that you are not very proud of, but it's something that's there. Yeah, it's part of you. The one way that I would answer it is that I get easily distracted. Yeah, and as a person, a weakness of mine, I've learned to focus on one thing at a time because I was easily distracted, especially during med school. You want to show them that this is a small issue and it's gone by now, and you have found a solution for it. But don't really put a lot of effort in making it a weakness and بطنة be strength, or like strength and بطنة be weakness, whatever is that word.
دكتور في بس تعليق برضو على نفس السؤال. يعني انا نفسي اكيد بتفق معك صراحه. شغله انك تحكي مثلا انا بيرفكشنست انا مش عارف شو، بصراحه بحسه هبل يعني للامانه. انه طريقه كثير يعني سطحيه للجواب، وصراحه راح يعني الشخص اللي قبالك مش راح يعني يحترمك على الجواب هذا، راح يعرف انك انت بس بتحاول تهرب من السؤال. صراحه بحس شيء انه ممكن هم يحترموه. وبرضه شغله انه انك تجاوب السؤال مثلا ضعف بشخصيتك، يعني مثلا انا عصبي او انا مثلا بستحي، يعني هو برضه هذا شيء مش كويس. ليش؟ لانه هاي شغلات انت بشخصيتك صعب تغيرها. فاذا انت بتطلع له اياها هيك، يعني انت بالاخير زي ما انت حكيت بدك يعني يو ونت تو سيل يور سيلف زي ما بتحكيها، فبدكش تحكي له شيء مش كويس عندك، يعني انت بتخرب على حالك. اظن احسن يعني من احسن الطرق انك تجاوب انك فعلا تطرح نقاط ضعف تفرجيه انه انت عندك انسايت بالسيستم اللي انت داخل عليه. انت بامريكا مثلا في عندنا نقاط ضعف كثير، مثلا منها مثلا المشاكل الطبيه الموجوده بامريكا احنا مش فاميليار فيها. مثلا انا بتذكر بالمقابله مثلا لما كان يسالني كنت احكي له الجواب هذا، انه انا مثلا في مشاكل بامريكا طبيه انا ما عمرها كانت يعني بمنظومه الطبيه اني افكر فيها، مثلا زي الاوبيويد ابيديميك، وقعدت احكي له مثلا يعني على سبيل المثال. بس انه مثلا بتحكي له بعدين بتجاوب انه بس انا يعني عندي يعني انسايت بالمشكله هاي وبحاول اقرا عنها واتعرف عليها. فانت لما تحكي له اشياء زي هيك، يعني انه تبين له انك انت واعي باختلاف الثقافات واختلاف المنظومه الطبيه بالاردن وبامريكا، اتوقع راح كثير يحترمك وجد يحس انك زلمه فاهم وفاهم شو بتسوي وفاهم ليش انت جاي هون يعني.
والله انك فهمان.
في سؤال بحكي please tell us about behavioral and ethical questions. So I've never seen or I've never had the experience of somebody asking like ethical questions about, like, for example, with this COVID situation, if you had two people to intubate, whom you're going to be intubated, you have one ventilator. I don't think that that is part of the ACGME interviewing questions, unless you have like a specific question. We really try to set and standardize questions for the applicants and not make it like crazy hard or something like that. Any advice on how to tackle the issue of repeating a year in med school? I do realize this is a red flag, but I don't think that they or anybody that goes through your school transcript, that's something for a fact. If something that's come up, just be prepared for it, because again, if somebody's asking about you, somebody is asking you about this, you're in an interview. So this is your shot to make it things looking better. And the way to look that better is that I had like a very difficult situation, this and this was happening. This is not a weakness. This is life, and people understand here. And في عنا, like, you wouldn't believe it, but into you guys, you probably your age is way less than a lot of the grads that are applying for residency and fellowship. There are med students هنا أعمارهم ب 32 سنة, med student. So you still haven't finished the med school. So I wouldn't take this as a bad situation. I would just be prepared if I get asked about it, because you're in an interview and this is your shot to get ranked high, because that's what all matters. If you end up matching, that's what cares. خلاص انت راح تخلص, راح تضب هدول الفايل تاعك وراح تحطه behind it, because you're into a process that everybody has been through, and it doesn't matter where you're coming from, what's your education, what's your scores. That's, you're going to completely forget about that. What should do the applicant preferred program offer as the first one and unable to reschedule? I think we talked about this. You can reschedule the interview. They're not going to be offended about it. So it's something completely okay to do. Don't feel that you have, if they give you this date and you changed it, that they're going to be offended or something like that. Let's see. Do program director lead letter of recommendation? Yes. So they read, a lot of people here, they really take their time. They read every single aspect of your application. Especially the program director, if she's interviewing you, or the faculty who's interviewing you. So I would definitely go, if you wrote the letter of recommendation, as some of us do, for who people are gonna be uploading it, is that I would definitely make sure that you know what you're talking about, and it's not something generic or something like that. Advice for matching into competitive residency, research tips. I mean, if you're going for a competitive residency, just remember that it's competitive and you have to take every shot. That's the only advice that I would really give you, because you never know where you're going to be ranked in that list. Hobbies and interests, they definitely matter. And the reason why they matter is that they always try to find something to break the ice. A lot of people put stuff in their CV, and a lot of the faculty use it to start the interview. So if you, for example, if you put in there, and I put there as a soccer player or like football, and happen to be a lot of the faculty here, they watch soccer and they play soccer, so they might start, oh, so you play soccer? It's something that they're gonna ask you about if they're trying to break the ice and get this interview going.
في بس بدي أعقب على شغلة بالنسبة للهوبيز، حاولوا يا جماعة ما تكذبوا فيهم، لأنه هذا الإشي موضوع كثير أندر ريتد بالنسبة لنا. إنه بتروح أنت مثلا بالابليك، هو مشكلة خلص يعني راحت، يعني هو الابليكيشن بيقدم، بس الفكرة إنه مثلا إحنا بنرش بنكتب سكر بولينج مش عارف إيش، بتكتب 1000 شغلة، وهم بالنسبة لهم الهوبيز مش إشي أندر ريتد، يعني هو إيش جد بيسألوه بالمقابلة. فممكن مثلا انت تكون كاتب مثلا بولينج، مثلا هو راح يسالك شو على سكور جبته بحياتك، طبعا انت بتكون تلعبها فور فن، بتعرف ترمي سبن وانت مش فاهم ايش بتكون. فبدكم تديروا بالكم من الموضوع هذا. يعني في مره قصه مع واحد كاتب انه هو هوايته الطيران، فكان البروجرام دايركتور بزماناته مساعد طيار، ففعليا ركبوا بالمقابله، يعني انه كان يساله الطياره والاعدادات، وهذاك الشاب يعني كان ما لوش دخل. فبدكم جد تديروا بالكم من الموضوع هذا، لانه هو بالنسبه لنا ايش اندر ريتد، بس عندهم شيء كثير بيهتموا فيه يعني.
Yeah, I 100% agree. I mean, there was, because like the American people or the American grad use this to stay away, because a lot of the applicants here are very mediocre. You know, you're gonna see people finishing from here with the low scores. They got really nothing to talk about. They bring up something in their personality that they want to direct this interview about. Like one guy, he was like an Olympic swimmer. He was an okay applicant, but he managed to get this interview about him swimming into the Olympics and losing at the end or something like that. But it's something like, it's good to kind of make it natural about something that you're good at, not just something to fill a couple of words in the CV. Having 1 year in ENT and applying for internal medicine, it really doesn't matter much. I remember we interviewed people who finished anesthesia and OBGYN residency for internal medicine. It's something that's in your CV and something to talk about. I did this in my country and I was good at it, and I'm coming here for the US because I really like internal medicine, blah, 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 something like that.
Dr. Izan?
Go ahead.
I have another question, if I may. Is it okay if an applicant is currently not working and not enrolled in a position or doing clinical experience? Do they see this as a weak point for the applicant?
So that brings us to the last part before we finish the whole questions, is that after the interview, a lot of the residency program have this scoring system. And the scoring system, they have this, for example, how many clinical experience they have, like a US or international journal or something like that. What's their scores? And most importantly, how many years from graduation? They kind of like put from 0 to 10 or whatever that number is, and they come up with a score. Now, they come up with this score, and I've seen them like computing that score. مثلا جاب 25 من 30. Okay, other people will score higher, other people will score lower, but that's not the only thing that's going to put you on the rank list. Again, as I said, people with a low like computed score with the scores and like the USMLE and the experience, but they have very good personality, that brings up the rank to top 10, for example. They're not going to go number 1, of course, because they're going to be a person who has a very high like score and has a good personality. That's what only makes sense, that this guy is going to be high. But the people who have a good personality, it will تطغى على السكور تاعهم, because that's what you're seeing now, is that the trend is moving away from having a strong applicant on paper. عشان هيك بدهم يلغوا USMLE scores to become pass and fail, because they want a good applicant like to deal with, not a person that's good in taking exams. عشان هيك the weight of the interview is as good or even better than the scores themselves. Christina had a question, I don't want to lose it. How to answer, where do you see yourself in 10 years? We ask this a lot, because if you are in academic place, they want to know that you're interested in academia. That's their kind of trick. That's kind of their trick to ask about this question. And in the way to do it is that they want to see what you're going to be doing after 10 years. So forget about residency, what are you going to do after 10 years? If you're applying for internal medicine and you are at a university hospital, they want to see that you're interested in academia. So I would answer, I would say, I want to see myself as a faculty at a good university hospital, teaching residents, working on research, with or without research. Just focus on teaching if you don't have the research experience. And that's where I see myself in the future. If you're going for a community program, you would say, again, you're trying to sell yourself. So I would say finishing my residency and be involved in a hospital that offers like a good hospital facilities and treating patients with busy practice or something like that. So that's the way I would sell myself, again, in knowing why they're asking you this question, is to try to see that if you fit for them. So that's the way I would definitely ask that. Would it affect the rank? Not necessarily, because if they like you as a person, if you're interviewing for a university hospital and they like you as a person, and you tell them that I want to just be a private practice doctor working in my clinic, for example, or something like that, they're not going to be offended, because a lot of people do that. It's not something bad. It's just something when it gets into a very tricky situation that you're trying to impress, and you're in a university program, you want to go for academic practice. If you're in a community program, you want to say, yeah, I'm going with the flow with you guys. So that's something important. If I have a common interest in a specific research topic with the PD, can I discuss it with the PD and bring it up in indirect way? Yeah, أكيد معتصم, you want to have the right segue to get into that question. Like if for example, the program director is internal medicine and cardiologist or something like that. You've done some cardiology research. I would kind of like lead this conversation by the way that you're presenting yourself. I've done this and that and this. I published this paper about this and this. You're gonna like kind of inviting him to ask you about it, kind of direct that interview toward that direction. How effective after the interview, we'll talk about this in a second. So if you have like an average profile and you feel that you're struggling with getting interviews, I don't know how is it going to be this year. I know that they start to send some interviews a lot of places. I would reach out to the connections. The US is based on connections, so there is no shame or harm or anything like that, because you don't know who's going to be able to help you. And again, sending the program emails that you are interested in this program and you want to come here if you get the chance to interview, you're gonna be able to impress them or something like that. That's what I would do if you're not getting interviews. It's again, it's a tough situation, but things might turn out to be really good in that way, because what I would suspect happening in the rank is that they might be ranking a lot of American grads, and then afterwards the IMGs will come. And what's going to happen is that a lot of American grads will match, so a lot of the programs will go down their list. And if you're ranked there, you're going to match, although you have a small chance or something like that. So that's what I suspect is happening. If there is a doctor that's pregnant during the interview season, that really doesn't change a bit. It's actually like they will do whatever. If you mention, like, let's say you mentioned that you're pregnant in the interview, or they notice it through like the video call or something like that, they will do everything to show you that they are supportive, because it's kind of like sexist for the faculty or something like that to say, oh, she's pregnant, we shouldn't take her. They will, if the ACGME find about this, they will shut down the program. So there's no shame or anything like that about you being pregnant. They will, if you're good, they like your personality, they will take you. If you are muhajjaba or whatever it is, I've really seen, I've been here in the US for 6 years now, and I've seen the change. I've seen from being completely against hijab because the patients might get offended or something like that, to completely supporting it. With a patient bihki ishi, they're gonna kick him out from the hospital. It's becoming more and more accepting. That's something for sure. Is it okay to mention?
دكتور ياسم بس في مجال تعمل ميوت مش عامل ميوت لو سمحت.
I think I did, Muhammad. Okay. Oh, okay. I'm getting, my mouth is dry. As an interviewee, do you think we will be able to know if we did well or not? So one way to know that you did well or not is the last part. Let's skip to the last part of this interview, which is the post-interview. So let me tell you first what happens is that, as I said, there's this form, the faculty fills it, the personality and the scores and everything, and the program director get this form, and they rank the applicant based on how well they did in the interview and how their scores, and that gets in the way. Now, what I've seen is that first, during residency, I thought sending a thank you email after the interview is something that's not necessary or something like that. But I actually found almost every time, unless they specifically ask you not to do it, every time that you send it, it goes a long way. Like during residency, اللي كان يبعت للprogram director, and I was good friends with her, اللي كان يبعتوا لها thank you letters, she was actually reading them, and it was actually affecting her decision. And the way that it was affecting her decision is that some applicants, they were honest with her and telling her, hey, this is my only shot, I hope I did well, if I get the chance to train here, I'll do my best. He's gonna get ranked. I don't know how high it will push you, but it will push you a couple of places. Maybe that's the way to match. I really don't know. But sending a post-interview an email to the interviewer and the program director goes a long way. And if you want to know if you did well, some people will respond to it. That they will say, we liked you too, we hope that you match here. That's one thing to know, that they really liked you or something like that. Apologies for repeating question. I'm not currently enrolled in a position. Is this really bad? Yeah, as I said, it's something that you have to come up with a reason for it and say that you're really interested in the US and that's why you want to do the training here. So I would just like kind of go in that direction. I think we're done with the presentation, so you guys don't have to worry about it. Let's see, going through this.
Can I ask a question, please?
Yeah, sure.
Hello?
Yeah, go ahead.
Okay, about the US experience. If you had the chance to match like directly after graduation with the step 1, step 2 scores and everything, or take 1 year to do a USK experience, which one would you choose?
No, I would definitely apply for the match. I wouldn't wait. So if I remember correctly, in residency, like I think we had a score of like 30, and the US experience had 1 or 2 points if they did like 6 months. If they did more than that, they get more than 2 points, like it's around 4 points. But I would apply for the match because you never know. Because again, you get to choose. You're gonna be ranking whatever you got, and applying for the match next year is not gonna affect your chances for this year or the year before. Like they're not gonna know that you applied for the year before. They get thousands of interviews a lot of places, and they don't really keep a track of who applied to where. So don't worry about that.
اوكي كمان سؤال عن اليوسكي. ايش بفرق اذا كنت انه medical student هلا since I'm a second year medical student I should have done my elective that in August but due to COVID I couldn't. So if I had to do it like after graduation or during MTS, does that affect or I should be a student?
I mean, so if you're during med school, you're going to be doing something elective rotation, where you get like to examine patients because you're technically a student. After med school, you're going to be doing something called observership, where you just like around with an attending and do your thing without touching patients or examining. Both of them, in my opinion, carry the same weight. As long as you're getting a letter of recommendation from whoever was going to write your letter of recommendation, that's what I would go for. I would definitely apply for the match. It's not a deal breaker or something that's affecting your match chances like very, very extensively. I would really focus USMLEs, good application, and applying for the match.
Okay, thank you.
You're welcome. Is it okay to mention your interest in fellowship? Yes. So I would definitely say, and this goes into like 10 year from now question, is that where do you see yourself in future? You would tell them I'm interested in some sort of a fellowship. I want to do this and that. One advice that I would be very careful, especially if you don't have a lot of like interview chances, is that I wouldn't be mentioning like you want to do, for example, a GI fellowship. And your program doesn't have a GI fellowship. And it's very hard for applicants to match into GI fellowship because it's competitive. That might something that they would draw them a little bit back from you. So I would be careful. But if the program has all the fellowship that you're interested in, I would definitely mention it because it's going to go a long way. And they want to say that this guy knows what he wants. He wants to do this and that. So I would definitely rank him because we want to see applicants going into fellowship more. How far do they go asking about your research? So I would definitely know all the research stuff that you put in your CV. You want to be you want to be able to present your research or whatever thing that you did in a small, concise way. He's not going to go into great details. How did you do this? How did you do this analysis? Everybody wants to feel that you did this research and you know what you're talking about. That's what all matters.
يعطيكم العافية.
Go ahead, Shakir.
مرحبا، آسف جدا على المقاطعة. أول شيء يعطيكم العافية على الويبينار، صراحة جدا مفيد. بس سؤال صغير على السؤال اللي سألته قبل شوي تبع الفيلوشيب. هسه معظم البروجرامز اللي أنا قدمت لها ما بتعطيك فرصة فيلوشيب، ف يعني أتجنب أجيب سيرته ولا مثلا إذا سألوني عنه أجاوبهم صراحة مثلا عن الانترست تبعي.
So that's not gonna be like if you're really committed to a fellowship, I would definitely bring it up. And أنا زلمة, I'm really interested in cardiology. It's the only thing that I want to do my whole life. But of course, you need the internal medicine training. So that's not gonna push you. The only way that I would feel that programs get a little bit drawn away from applicants is that those programs who have some fellowships, but they don't have the fellowship that you're looking for, and you bring it up as you're really interested in it, they might just feel a little bit weird. But if they don't have fellowships at all, like a community practice, then you want to do fellowship, that's great. They will support you to do it, and it's not something against you or a weakness.
تمام، شكرا جزيلا.
Yeah. A letter of recommendation, I would definitely, the post-interview thank you email. أنا أمنه علي, during fellowship, I've seen them sending it to everybody. And it doesn't harm. I would send it to everybody. You're not. It's just an email, and you never know who's going to be the person vouching for you during the rank list. So
ممكن
I would
أسأل؟
send it to everybody.
مرحبا.
Go ahead.
بعد سؤال بس شكله ما بين. هلا بالثانك يو ايميل بعد الانترفيو، هل تنصح اذا حدا عن جد انترستد في بروجرام معين انه يكتب عن جد انه هو انترستد في هذا البروجرام بلا بلا بلا، يعني يحاول خلينا يحكي يقنعهم بشكل او باخر انه حيرنكهم عالي يعني بشكل غير مباشر؟
Again, it's not a violation of ACGME or the match to tell the program that you're ranking them number one. It's a violation for them to tell you for them to ask you where are you interviewing. بس إذا أنت بتحكي لهم إنه أنا مرنكم number one, for them it goes a long way. هلا whether you're saying it to everybody, they're not going to be able to find out. You're interviewing the whole over the US, so it doesn't really matter. But I would be careful. Like I wouldn't be ranking top programs in the same city, for example. You never know. Maybe somebody knows someone. So I wouldn't be taking the risk. But I would definitely say specifically, very explicit, hey, this is my number one program. I'm really excited that I got the interview. I really hope that we can work together in the future or something like that.
تمام شكرا.
Do they know if you're a repeat applicant? As I said, no. They might remember vaguely some sort of a name, but the match itself, it prints the CV and that's it. They don't know how many times you applied or anything like that. Let's see.
عن الوقت خليني احكي لك عن الاسئله. انا يعني متبع الشات. في دكتور عن المون لايتنج، عادي واحد يسال عنه بالمقابله ولا كيف؟
ولا اذا انت US citizen على as a general position you cannot moonlight unless under a very specific situation. بس إذا أنت US citizen, it's not offending at all to ask it. I would ask it to the residents though. I wouldn't ask it to the program director. إنه هاي أنا جاي عشان في moonlighting عندكم. So I would ask it to the residents if they do like a pre-interview dinner or something like that, virtual or something. So that's definitely I would do.
ودكتور في بالنسبه في يعني اكثر من مره نسال السؤال هذا، في ناس عشان هو انه في ناس متجيه لحد لا مقابلات، هل المفروض يخافوا من الشيء هذا ولا السيزون لسه باوله؟
I think it's still early. هلا the most of the people who are getting it are the ones with good scores and the IMG applicants, the AMG or the American grads. Once they start going through these, they will start sending interviews to people who are like on the wait list, as we say. So it's still early. I would say probably around mid-December is where you should have something going on, maybe late December.
تمام. دكتور في ممكن مثلا نعمل زي نصائح هيك عشان الليتر اوف انترست نسال اسئله كثير. انا بصراحه بحس يعني مثلا لو تبعث ايميل قصير اول شيء اول ما تبلش المقابلات بانجازاتك وسكوراتك هيك، لانه الواحد صراحه بيكون مقدم على كل امريكا فصعب تكتب ليتر اوف انترست خاصه لكل بروجرام، اتوقع ما بتضر. بس انه بعد المقابله الليتر اوف انترست المفروض تكون يعني مور سبيسيفيك. شو رايك؟
Yeah, and short because you don't want to be writing a very long email. Because أنا بقول لك يعني the program director will be literally reading your email between like walking the hospital between patients' rooms. He's not going to read the full like 3 paragraphs. I would say 2-3 sentences. Hey, I really like this program. This is my top program. Blah blah blah. I specifically like this in your program, and I want to come here.
حلو.
بس
آسف ممكن سؤال صغير. تفضل آسف.
بالletter of interest قبل الانترفيو, make sure you don't make the mistake of writing. We've seen this a lot where people send an email ويحط dear Dr. Stevenson and he send it to 10 different programs and it's going to show up as you're just copying and pasting and sending emails. So be very careful with to whom you're sending the email. Go ahead أحمد.
هلا أنا مقدم على بيدياتريكس، سكوراتي خلينا نحكي افريج أو حتى ممكن بلو افريج. في واحدة من الانترفيوز اللي طلعت لي في مكان فتحت عليه ما باخذ، هو يعني they don't sponsor فيزا. أنا ما بدي فيزا، بس الغريب إنه كل يعني تفرجت على الريزيدنتس كلهم القدام واللي تخرجوا من عندهم كلهم خريجين امريكا، يعني كلهم AMGs. فهل في شيء قاعد بتغير هاي السنه؟ هل يعني
No, again, man, you passed some sort of a checklist that they're looking at the applicant. So I wouldn't really care whatever it is, even if it was like it was a top ranked program or whatever it is, I wouldn't care. You get the interview, just focus on it.
اوكي ثانك يو.
ممكن أسأل سؤال دكتور؟
Go ahead, Muhammad.
How can I use a US clinical experience as a medical assistant in a specialty and I apply to a different one?
It really doesn't matter. So I mean, يعني احنا الدكاترة we know, especially program directors, مر عليهم أشكال وألوان من الناس. So they've seen people who've done surgeries وراحوا على internal medicine. We've seen people who've done the exact opposite. So it is something that not against you, and you should use it as a person who had the opportunity. إنه لا هاي الجوب, it wasn't the thing that he wanted, but he continued on it, and this is what you eventually want to do, and that's why you're applying. There's nothing wrong with that. يعني. Again, يعني as simple as in الشغل مش عيب, even if you are working in a completely different department or something like that.
Okay, and to be specific, when I worked at that clinic and that specialty, maybe without residency or without, do they consider it that I don't have the license or the authorization to work as a medical assistant before doing residency? That's my question.
You usually get the license as you start the training. I don't know if I got your question wrong, but the license ملاش دخل بأي شيء يعني.
Okay. Yeah, thank you.
طيب يا جماعة، عشان طولت
يعني
بس إنه دكتور هسه لو تختار يعني بس اللي هي الأسئلة، خلينا نحكي اللي ما تجاوبت قبل هيك، و خلينا نحكي يعني خلينا ناخذ 5 أسئلة هسه عشان نخلص الويبينار.
Yeah, I think it's an hour and a half, so I think we're pretty much to the end. I didn't see any questions popping up after you asked. So I think there's the question of if you can't find anything about the hospital, I would say Google the name of the doctors. You're going to be able to find something about them, but it's not a good sign that they don't have a website for the hospital. Can some programs stop sponsoring visa this year due to COVID and travel delays? If Trump was still the president, that might have been an issue, but I think things are going to loosen up, and things are going to be easier. So I wouldn't worry about the J1 visa. There's no way that the US will be able to fill the number of vacancies for physicians and residents by just doing American grads or not doing visa. They have to do it. They are forced to do it. عندهم مستشفيات كتير وعدد الأطباء اللي بتخرجوا من عندهم قليل كتير. You don't think إنه مثلا جايين من الكاريبيان hospital have an advantage. No, they get treated exactly the same. I think
تعادل مدريد وفالنسيا. مين اللي بيحضر المباراة يا جماعة؟ اعملوا ميوت لو سمحتوا.
عملت له ميوت. I think is it possible for a program I ask applicant to interview? I don't think so. If the programs, they will not be able to invite applicants with this COVID restrictions. Yani, it's very hard to do elective rotations هلا. It's very hard to invite applicants to do in-person interview. Think that should be it. لازم أنا أروح.
تمام دكتور، الله يعطيك العافية. يا جماعة أي واحد إذا عنده أي سؤال ممكن لو يبعث على الإيميل أو كذا ممكن نجاوبه. حاب بس أذكركم إنه إحنا عملنا ملف للماتش، يعني برضو تقدروا ترجعوا له. إذا عندكم أي سؤال يعني أنا أكثر من جاهز إني أجاوب عليه، وإن شاء الله يوفق الجميع. صراحة حاب أحكي لكم شغله، إنه يا جماعة أنتم بهاي المرحلة أي واحد وصل المرحلة هاي هو فايز، يعني بغض النظر أجا مقابلات إيش ما صار معه، إنه يكون جد مفتخر بحاله. ويعني الموضوع صدقا مش راح يكون موضوع أوبجكتيف، يعني الموضوع راح يكون فيه شوية موضوعية خلينا نحكي. فيعني إن شاء الله يوفق الجميع، وإن شاء الله أي سؤال أي شيء يعني إذا بتحبوا تبعتوا لنا برضو راح نجاوبكم. ونشكركم كثير. اخر شغله بس يا جماعه، احنا حطينا فيه فورم يعني نزلنا بوست عن فورم، بتمنى انكم تعبوه يعني اذا في مجال، وبالتوفيق للجميع ان شاء الله. يعطيكم العافيه وشكرا لكل اللي اجى.
يلا مع السلامه.